Hey students, let's discuss fat embolism, a very important topic for your exams. And fat embolism is a rare but having grave complications, having high morbidity. So it's important to know all the key facts. So please make sure to jot down all the key facts regarding fat embolism. So fat embolism, the common causes. What are the common causes? The common causes are fractures of long bones. This is to be remembered. You get clinical vignettes regarding that. There is a fracture of long bone, especially in road traffic accidents. Femur is the typical bone to be fractured, and the bone marrow containing fat globules release the fat globules in the stream, in the bloodstream, and that causes fat embolism. So fat is released from the bone marrow fat component. And also pelvis bone is also one of the common site. Apart from that, orthopedic surgeries, bone marrow transplantation may also lead to some kind of a trauma and can cause release of fat globules. Apart from that, trauma to other fat laden tissue like breast, even fatty liver also can sometimes cause fat embolism. And fat embolism can also be seen in non-traumatic cases like sickle cell crisis and some pancreatitis, osteomyelitis. So in non-traumatic cases, it is being postulated that there is because of increased inflammation, there is increased cytokine, and increased cytokine causes release of fatty acids and chylomicron, and there is activation of lipase, which causes activation of release of fatty acids and chylomicron, which form emboli and which circulate in the bloodstream. That is being the postulate. Pathogenesis. So here, after the fat globules are released into the bloodstream, they obstruct the microvasculature and causes severe ischemia and hemorrhage. So ischemia and hemorrhage are common. And fat and fatty acids which are released damages the endothelium of the blood vessel and causes platelet thrombi. So inside the blood vessel intramural, there is a platelet thrombi formation due to the injury to the endothelium that is being inflicted by fatty acid, which acts as an injurious agent to the endothelium of the blood vessel. That has to be remembered. So fat embolism, many of the cases, if it is not significant, it will not be symptomatic, but many of the cases are symptomatic, and symptoms typically start after 12 to 72 hours. This is the important thing to be remembered, which is there, which is asked in your vignettes, in your questions, that the clinical history is being given and the patient starts presenting with pulmonary symptoms, neurological manifestations after 12 to 72 hours. More typically after 24 hours, most of the cases, but 12 to 72 hours is a broad range. And the common clinical manifestations which you should remember, that is must to be remembered, are the CNS dysfunction is a common feature. Restlessness, delirium, coma is being can be seen in severe cases. Respiratory failure, because it obstructs the pulmonary vasculature. Dyspnea, tachypnea may be seen due to the consumption by the platelet thrombi, consumption of the platelet in the platelet thrombi. You may get thrombocytopenia in the peripheral bloodstream, and that may lead to severe petachia over the skin, chest, and upper extremities. Those areas, the skin of those areas may show petachia because of thrombocytopenia. And diagnosis, or you may do a complete blood count analysis. There may be some anemia. Thrombocytopenia is more commonly seen, and ESR may be raised. And more specifically, you may ought to do fat globules that can be seen in blood, urine, and sputum examination, and which can be accentuated by doing oil rado stain. So these are the important things. Fat globules may be seen sometimes, particularly in urine and sputum examination. It may be noted. Treatment, supportive treatment has to be given, and no specific treatment is recommended for fat embolism. So here you see the emboli formation inside the pulmonary vasculature. You see the emboli formation, and here which are accentuated by this oil rado stain, which is highlighting the fat globules. And here you can see the hemorrhages. Small emboli are seen, and hemorrhages are seen in the brain. And again, you can see the oil redo stain highlighting the fat globules. So to summarize what we learned today in the fat embolism typically occurs due to trauma and some non-traumatic inflammatory causes as well. Trauma to the long bone like femur and pelvis are the common causes. Symptoms typically start after 12 to 72 hours after the incident, and the fat globules obstruct the vasculature. And here you see typically the CNS symptoms, CNS manifestations, confusion, convulsions, delirium may be seen, even coma may ensue in some cases. And respiratory difficulty is the most common symptom. Respiratory symptoms, tachypnea, dyspnea, that may be seen, and that is seen in almost all of the cases. And diagnosis can be done by doing CBC examination. We're looking for thrombocytopenia, and also there will be fat globules that may be enumerated in oil redo examination in tissues like urine, sputum, and even tissue biopsy also will enumerate emboli and hemorrhage formation, and can be detected, can be confirmed by oil redo stains. And thank you for your learning. Please like, share, and subscribe to the channel, and please stay tuned for the next video. See you next time soon. And we have also launched our 10 days crash course for the students. So those who want to accelerate their learning and get ready for their exams in 10 days, they may contact us individually for 10-day crash courses. Thank you for your learning. See you in the next video. Happy learning.